one, and I'll just hop into this one. This one was another study, again, driven by cost. So implant cost has definitely become an issue. And recently, we're now getting graded on the joints doctors are getting graded on the cost of their implant, basically. You'll see it posted in the surgeon's lounge. So we've started using more all-polyethylene tibias. So this is a tibial base plate that's made all of plastic and is quite a bit cheaper than the standard modular trays. So we looked at all of our all-polyethylene tibias that were posterior stabilized. So a little bit of background, all-poly tibias first came out in the 1980s. The original designs were flat on flat, so not really a conforming design like a modern total knee. And there was old polyethylene, which we know had issues. And these failed pretty miserably. There's a few studies that showed very early tibial loosening and early catastrophic failure. So this was abandoned in large part in the 80s and early 90s. As cost has become more of an issue, there's been renewed interest in all polyethylene tibias. We really have to thank Europeans and especially the Mayo Clinic, as they did continue to use the all polyethylene tibia and have produced some interesting studies as a result. So looking at their studies in that interim, they have shown good survival in their large registries and really no evidence of tibial migration and loosening on well-done randomized controlled trials. The majority reported are cruciate retaining, and the thought was it would put less stress on the tibia as there is no post. And most of these are older implants. None of the implant companies are really eager to undercut themselves and give us a modern design with an all polyethylene tibia. So because of this, I thought we had an opportunity to add to the literature out there. This is one of the largest studies out of Europe, out of England, where they looked at all polyethylene tibias, again a CR knee, in about 50 patients, and they used radio markers in the polyethylene to see if it is actually loosening, and they saw no difference between that and a metal back tibia, and their survival rates, in the high 90s at 10 years. So we looked at all polyethylene tibias with a minimum of 2-year follow-up. We ended up with 53. We did a case-controlled study, matched them with age and sex to patients with a metal back tibia. And then we looked at our outcomes, our all-cause revision rate, our knee society score, and our final range of motion at the most recent follow-up. So we had 53 in each group. The demographics were no different. The comorbidities were no different between the two groups. Our outcomes, our flexion, our knee society score, and our revision rate all were equal between the two groups. So we really saw no difference between the two groups. So strength. So this was all with a modern posterior stabilized implant. All the implants that we use, they have the same congruity as the metal backed tibia. We have at least 2-year follow-up, which is the minimum for most studies. And then we also published on functional results, which a lot of the registry data just don't have. Weaknesses. This is obviously underpowered. We just don't have enough subjects at this time to. If there is a subtle difference, we're probably missing out on it. But I do think this does add to the growing literature out there, especially on posterior stabilized tibias, and we did not find any obvious difference between the two. All right, that's it.